It's a stark and sobering message from Dr. Tedros. No one is safe until we are all safe. But is this message falling on deaf ears, or ears that want to hear a different story? The world is so keen to get back to work, to school, to travel, to move on. I woke up to the news today in the UK that everyone here aged 50 and over will receive a third jab, a booster jab in September. In the US, children aged 12 and above are getting jabbed. How do we deal with this great COVID divide that Tedros has just pointed out to us? I am delighted to welcome to the stage Parliamentary Under-Secretary of State for COVID-19 Vaccine Deployment, Nadhim Zahawi. Welcome.
Thank you so much.
Let's just go right to it. How fair is the global vaccine rollout?
So let me just take a step back, and I think Dr. Tedros is right to say that we need to protect the whole world, which is why my Prime Minister Boris Johnson has set a target that we vaccinate the whole world by the end of next year. When we set up the Vaccines Task Force way back in March, April of last year, it was given two priorities, equal priorities. One is discover the teams that will deliver the vaccines, contract with them, or bring them to the UK and manufacture in the UK. And we're manufacturing 3 out of the 8 vaccines that we have contracted with.
Impressive.
So that's priority number 1. Priority 2, equal to it, way back then, for the Vaccines Task Force is give me a strategy of how you're going to help the rest of the world. So we were instrumental in putting together the COVAX infrastructure. We put 540 million, so £500 million to work to manufacture 1 billion doses for low and middle income countries. We went further in that the vaccine that the British taxpayer has effectively supported in its development, the Oxford AstraZeneca vaccine, that is delivered at no profit whilst the pandemic is with the world. So about 500 million of the 1.5 billion doses that have been produced already of vaccines, 500 million is Oxford AstraZeneca. The majority of that, over 80%, is going to low and middle income countries. And that is rising. So when I speak to the Serum Institute of India, they're currently at 100 million doses a month production of the Oxford AstraZeneca, about to move to 200 million doses a month of Oxford AstraZeneca. Pfizer equally, and I pay tribute not just to Pascal Soriot at AstraZeneca, but to Albert Bourla at Pfizer. From the outset of our negotiations with Pfizer-BioNTech, they always spoke of vaccine equity and equality, and they will also deliver their vaccine at cost for low and middle income countries. So 60% of their production will be that. Now, when you look at production globally, Novavax is about to come online again. The Serum Institute is actually, at the moment beginning their manufacturing of the Novavax vaccine. All the manufacturers, so take Pfizer, last year, their estimated production for 2021 was going to be about 1.2 billion doses. They reconfigured their manufacturing. They're now slated to produce about 3.1 billion doses for 2021. AstraZeneca equally has now 20 facilities around the world manufacturing at scale, already at 500 million and rising for low and middle income countries, the bulk of which is for low and middle income countries. So actually, production-wise, we will see the numbers being delivered. My fear is that you deliver those vaccines to warehouses, but many countries, low-income countries, middle-income countries, don't have the infrastructure to deploy at scale in the way we have done in the UK our vaccines. So part of it is supply, and that's right, and the G7, we pledged another 100 million doses. So on top of what we've done with COVAX and AstraZeneca, we pledged another 100 million doses of our own excess doses, of which 5 million immediately, 20 million by the end of the year, the balance next year of the 100 million. The United States President Biden pledged 500 million doses. In total, at the G7, it was 870 million doses for deployment, 50% certainly by next year, at least, if not more. So the supply, I think, is getting better. I think where we really need to focus is, can these countries, how do we make these countries have the capability to be able to deploy at scale in terms of healthcare infrastructure that can take the doses out of the warehouse out of the fridges and into people's arms.
Is there a good example that you could point to of how a low or middle income country is able to do that, something that could be replicated?
So one of the things my team has done at the Vaccines Task Force is exactly that. So there's, I think, now over 90 countries who've received doses from COVAX. And with the Pfizer-BioNTech vaccine, of course, the movement, the cold chain movement of minus 70 degrees is challenging. So we've shared knowledge with other countries, whether in Ghana, when the vaccine landed in Accra, that was actually AstraZeneca vaccine, or the Philippines or elsewhere. What we try and do is also share knowledge as to how we are administering the vaccines. But I think this is a global effort. I mean, we need, the Médecins Sans Frontières, who are doing a tremendous job, and other global, UNICEF, and other NGOs to come together, because I think the big challenge, counterintuitively in many ways, everyone's talking about supply. From what I see, and I live this every day, and have been for the last 8-9 months, supply, actually the manufacturers are really ramping up. It's going to be administration. It's going to be actually deployment. How do you operationalize a deployment to get to the ambitious figures that Dr. Tedros talks about? We are now at almost 85% of all adults in the UK protected with 1 dose, 62% protected with 2 doses, and our target is to get to 66%, so 2/3 of all adults, to have 2 doses protection by the 19th of July, when we reach step 4 of our roadmap to reopening our economy.
I appreciate what you're saying about supply, that you don't think that is the main problem. We did interview the foreign minister of the Gambia yesterday, who said that they had run out of vaccine, of AstraZeneca. And he pointed out that one person in the Gambia who's employed supports 10 other people. So there's an incredible link between vaccine inequity and unemployment. And they have a problem because they also, 1/3 of their GDP is based on tourism. We have a situation where people aren't flying, people can't move. So it's a critical, it's a sort of crunch point, isn't it? And I appreciate this idea that the supply will come. Is there any way to get it faster now?
So the point I'm making is, of course, supply is challenging. I'm a chemical engineer by background, and in any manufacturing process, there's going to be challenges at the outset. Just remember, we've only had this vaccine with us since we were the first sort of major economy to authorize the Pfizer-BioNTech vaccine on the 2nd of December and begin deployment on the 8th of December of last year. So it's only been 7-8 months that we've actually had vaccines for the world. Supply is challenging, don't get me wrong. But I think supply, the manufacturers have really begun the ramp up, and you're going to see a step change in that, in the volumes I described. So if Pfizer goes from 1.2 billion slated for 2021 to 3.2 billion, AstraZeneca equally getting to those sort of numbers, and then you've got Moderna and Novavax and others, and of course Johnson & Johnson with their single-shot Janssen vaccine. It is challenging, but I think to your point, supply is coming. I guess my plea to the world is begin to think about deployment, because the worst thing we can do is have these vaccines sitting in warehouses where obviously they are time limited, and we want them out into people's arms and protecting those people. So both are challenging, but from what I'm seeing on the ground, on the front line, is the supply side has responded, and you're going to see hundreds of millions, billions of doses that will end up in low and middle income countries, rightly so. The G7 pledged a billion doses that will be delivered, 870 million, I think, doses in additional funding to produce more to get to that billion for low and middle income countries. So I think that is a challenge, but actually that is being addressed by the manufacturers really in a big and strong way. It is also making sure that those countries that don't have the healthcare systems that can put the doses out of the vials into people's arms actually are able to do that as well.
So where do you stand on the case at the WTO? Yesterday, Piyush Goyal, the Minister of Commerce in India, gave a very rousing statement for the world to lift the IP on vaccines. the case that the WTO, that India and South Africa have brought is not being heard, is not being supported by the richer, by the higher income countries. It's not getting any traction. So where do you stand on that?
So President Biden, if you recall, just before attending the G7 at Carbis Bay, talked about looking at IP and how we deal with that. We would absolutely look at any text that is presented to the WTO and consider it, because no one is safe until we're all safe. We have to transition this virus from pandemic status to endemic and deal with it in future years in the way we deal with flu globally. So I think we will absolutely look at that. My one word of warning, because I'm so sort of operationally deep into the work that we've done in the United Kingdom, certainly, on both the Vaccines Task Force and on deployment over the past 7-8 months, is that if you sort of think that this is sort of binary solution, simple solutions don't generally work in a complex manufacturing system, where if you look at, say, for example, the Pfizer vaccine, I think there's 180 plus components going into that delivery of that technology and that vaccine. If you, say, for example, create a situation where factories that are not quite capable of producing that level of safety of medicine suddenly begin to think, oh, well, I'm going to get the IP for this because IP is going to be waived. They start buying components. So then you create a shortage in components around the world. That's my only word of warning, is we need to be really careful. When I look at what we've been able to do with Oxford AstraZeneca vaccine, it's the technology transfer. Let me give you an example to bring it to life for you. One of our best facilities is in Oxford Biomedica, in terms of both the batches and how good the quality of the production process, and of course the yield that you get out of the vaccine. The Helix plant in the Netherlands took a lot longer, and we actually had to send engineers from the UK to get the technology transfer right, so that the Helix plant for the AstraZeneca production for that vaccine to be equal to the Oxford Biomedica production. So technology transfer is not easy. You see it with some of the more innovative companies, whether it's Moderna or Novavax. The manufacturing process to get to that level of quality control and safety is really important. So that's another consideration. Sometimes it can be simplistic to say, let's just have an IP waiver and everything will be fine. The reality on the ground, and I speak as an engineer, is actually what Pfizer and AstraZeneca have done is the correct thing, which is to transfer technology and increase production safely and at scale, and have that sort of control in terms of quality control that you really need. Because to maintain confidence. The worst thing we can do is that vaccines are, the manufacturing process is somehow flawed, and then you lose confidence in the safety and efficacy of the vaccines. We, in our presidency of the G7, have a big campaign on vaccine confidence globally, because we've managed to achieve 94% vaccine confidence in the UK. 94% of all adults in the UK, according to the Office for National Statistics, say that they are very likely, most likely, or have already taken the vaccine. We're almost at 85% of adults have had one dose, which is a remarkable achievement. We want to share that with the rest of the world, because the anti-vaxxers, the malign influence that want us to stop vaccinating the world, are not just focusing on the UK, they're focusing on other countries in terms of just sort of sowing the seeds of mistrust and distrust in vaccines. Vaccines are our way out of this. What we're seeing now in the UK is the transition of this virus from pandemic status to endemic status, with the booster campaign in the winter, and then I'm planning for an annual vaccination program, working with the manufacturers in India and, of course, with the rest of the world as well. We need to do that for the rest of the world now. We need to share the experience of the UK, share what we've done in the UK with the rest of the world, because we need to transition this across the world from pandemic to endemic status.
So let's talk a little bit about the strategic importance of the UK-India healthcare partnership. Tell me some of the tangible benefits that we can see from that.
Hugely important. So let me give you an example just to bring it to life for you. The Serum Institute of India has now the ability to supply, as part of AstraZeneca's supply chain, the vaccine to countries like the United Kingdom, because our regulator, the MHRA, actually regulated the manufacturing process there. They are looking not only to ramp up now from 100 million doses a month to 200 million doses a month of the Oxford AstraZeneca vaccine, which is exactly to the point that you and I have been discussing, to protect the rest of the world. That in itself is a massive achievement. Why? On the back of one of the most highly regarded regulators in the world, the UK regulator, the MHRA, they've been able to go out and say, look, we are one of the safest, best vaccine manufacturers, one of the largest vaccine manufacturers indeed in the world. Now, they're about to also manufacture the Novavax vaccine, looking like a really great vaccine, the Novavax vaccine. Again, by having the Serum Institute able to say we're regulated by the MHR, the UK regulator, that is a huge step forward in terms of vaccine production and protection for the whole world, and of course for us here in the United Kingdom. India's aspiration to be the sort of the pharmacy of the world, I think, is one that is incredibly exciting for us. You know, I have a very big flu campaign that we are about to embark upon with the COVID booster campaign from September
One in each
onwards.
arm, is that right?
Yeah. So the good news in terms of reaction, sort of reactogenicity, as the Deputy Chief Medical Officer would put it, Jonathan Van Tam, the great JVT,
right,
is that one in each arm is extremely safe. We obviously are waiting for the clinical trials in terms of which vaccine to use that will give the greatest protection in terms of the most vulnerable cohorts that we need to protect further from the virus circulating in our communities, because as we lift the final restrictions in step 4. And of course, my big concern is I don't want to be able to punch the air and say we've vanquished COVID in the UK, and then because of the lockdowns, because of the non-pharmaceutical interventions, the severe lockdowns we've had very little flu virus circulating in communities. What I don't want to have is come the winter, a very bad flu season that will put even more pressure on our NHS. So the plan is to be able, wherever possible, to co-administer flu and COVID boost for the autumn. And then in future years, the beauty of science is, a number of the innovators in this area are looking at a single jab with right, COVID and flu. So, every day that goes by, we're getting to a better place. My Prime Minister announced a global collaboration, a radar system, so we can track any viruses around the world, so that we don't find ourselves in the same sort of precarious position as we did back at the beginning of last year with COVID. So lots of exciting things to come from the UK-India collaboration.
All right, thank you. Well, we want to get you back next year to hear how it's all gone. Thank you so much, Nadhim, Zahawi, for joining us here at India Global Forum. We will stay with the COVID-19 topic, go deeper into vaccines administration, and also look at some of the innovations that are coming on board from innovators in the UK and in India as well. So do stay with us.